The pterygoid, huh?
Oh, this side.
No, this is the last time case. Yeah. It is also somewhat, no? It is kind of
Trans
sinus and so what we can do is, here we got a good bone here. See, actually we should have tilted little more, but we didn't tilt it
And
fully.
is it engaging the bone?
Yes, it is engaging the bone. See, this is the mesial aspect of the implant.
Okay.
But the distal
It's
part is partly into the sinus, but the tip is. So what we can do is we can place one implant next to the central incision.
No.
No, yes. I think definitely after surgery you will go and check 1, 2, 3. Now, if you see, the tips are little close to each other, but that is not a problem. But if you put this implant parallel, close to this implant, then it is there. If the tips only are touching each other, not it. This implant came nice. This implant we went along the palatal plane, so it went here. If you come more vertically, it will exit it here. Can you see? This is a lateral pterygoid. This is a metal pterygoid. This is exiting here. So instead of placing pterygoid here, we can place one implant here, and we can finish the bending also. Otherwise, it will go inside.
That is a problem.
Otherwise, no.
If sinusitis, patients having sinusitis, then we should take care.
Active sinusitis, then it is an issue. It is a chronic sinusitis, also no problem. If patient is having active sinusitis plus and all, then. If you carefully observe, the right tilted was going through sinus and then it is catching. So when I was bending, there was a little shake, no? Some movement inside the bone happened, but that is okay. Once you connect everything with it, that is
There won't be any like for D3 or D4
Yes, that is one important thing. So planning again revising what tooth to remove, how many tooth to replace, how many number of implants. For
Design.
location, then design, width and diameter and length, and then whether you are going to place straight or angulated. Okay. When not to place angulated implant? When the bone is soft. When the bone is soft, don't place angulated because you cannot bend. Even if you bend the entire bone, the implant will move through the bone. It won't bend in the neck, whether it is multi-unit or single piece. In those situations, conventional implant is better. You are not bending the implant. You are just placing a multi-unit.
In conventional, what do they do with pterygoid implants? That will also be in angulation.
Angulated, they will have a separate multi-unit.
Okay, that has angulation. So
That is angulation, yes. It's a very osteoporotic bone, no? Very osteoporotic bone. Many patients, they come above 45 years, women, the bone density is coming down. Better to we have to, all full mouth cases, we have to take vitamin D test.
And we should supplement.
Yes, vitamin D take test, then based on the value you can, mostly it will be
Calcium.
Calcium also. See, blood calcium won't reduce. Blood calcium is the, body will compensate to keep the blood calcium in the normal. Only the vitamin D is important. Vitamin D, HTL, LDL, and we tell to take HB, A1, default to all patients. So osteoporotic.
if they are diabetic, you don't do.
No, we will go.
Just to know.
Yes. We tell them to start medication from physician and we start it. Because with so much of infection, they cannot control sugar. This also adds to the problem.
Heavy smoker.
For diabetic and all, they are not taking any concern. If it is a heart issue,
range to do the
even up to 300 we will be doing.
But try to get your insulin for that
No.
அப்படி HbA1c is nothing to do with அது வந்து fluctuation measure பண்றது தான் HbA1c.
See, one is hyperglycemia. Then another one is hypoglycemia. Diabetic patients, they are very much strict during surgery. They will think not to avoid sweet, but actually they need blood sugar during the surgery. During the surgery, hyperglycemia is more favorable than hypoglycemia.
Yeah.
Hyperglycemia 300, 400, they can live for months. But hypoglycemia, they cannot live for minutes. Okay. One patient, the blood sugar went very low and he went to fits mode, epileptic mode. The problem is, once we know that it is due to hypoglycemia, we cannot give blood sugar also because he will be in some disease stage. So better to give, in between the two surgeries, upper jaw and lower jaw, we give juice. We put glucose over that, in the our best juice is sugarcane juice. Actually, it contains a lot of glucose. We will not tell, they are taking
Sisters are on.
from nearby lab we have to tell. So better keep them, tell them to take nice eating, not to take any oily food. Some patients they come without taking breakfast, thinking that they may do vomiting and all. So we have to be very careful. So we have we are doing kanji in the clinic itself. So if they are not taking any breakfast, we will do kanji. So that is a millet. So that releases blood sugar slowly. If they eat idli, within 1 hour, blood sugar will go like this and it will come down like this. If they do take some millet kind of thing, it will sustain for 3 to 4 hours. In between, we will be giving some juice. Pomegranate juice is actually so hypoglycemia. We should be very careful. The problem in surgery will happen. One, because of hypoglycemia. Second,
But there is no reference range for that.
Blood sugar.
HbA1c, that is.
it is around 6 or 7. Below it is okay. Even up to 8, 9, 10 we can do. Provided we give good antibiotics before the procedure and during the procedure, lot of irrigations.
How about the para-oral functions, sir? Any bruxism?
Yeah, definitely it is a main thing. When it comes to prosthetic part, bruxism is the main thing which can destroy the prosthesis implant. So you have to do, so by default all full mouth we will be giving all full mouth patients. The final after fixing the day, the same day we will take impression, we will core model, we will do bite spin and we will lay this.
Soft spins.
Soft spin. That is why to compensate these bruxism issues and all, we are placing some extra implants. If some more implants are there, they will take up the load. So see the amount of severe bone loss, like bone. See though, I told in the first day, unilateral chewing is the destroyer of teeth than the gum disease and dental caries. Because of unilateral chewing, he is chewing only unilateral side. Comparatively, this side looks better. Like this side is onion, this side is onion. See the crowding. Inter-implant distance should be say 2 mm, 3 mm bone. Otherwise, what will happen? That bone will not get blood supply to resolve. Same concept applies in natural teeth. These teeth are very close to each other. So very thin bone between the tooth. They get less. That is why anterior crowded teeth, they become more mobile. So till the apex bone loss, that means all the alveolar bone has been lost. Only the basal bone is present. Those definitely this will be a challenging case for lower. So first we will go for the lateral incisor. So as usual, regular planning interforamen of 4 implants, distal mandible 1 or 2. Okay. By seeing itself, we come to conclusion that 7 and 8 better to avoid. There will be severe bleeding. Even if you plan nicely, there will be a lot of bleeding will happen. Okay, orientation will. So better to place 1 implant in the 6. Okay. Here mesial root totally no, right? Here metal foramen. Here mesial root. Either distal root or 7, it looks good.
So in such cases, either to prevent that kind of situation, extract it, leave it for a few days, and then we can plan it.
Once the bleeding settles, yes. Some conventional doctors, they are doing it. Recently, I went for it.
But that is 7 only, Anyway, we need not replace it and just leave like
Just
that.
leave it.
Because
but
6 is
only
okay.
to place anchorage, we are going till 7, not to give 7.
6 is okay.
Yeah. One approach done by some conventional implantologists is they extract all the teeth first day. 2 weeks they wait. After that, they ask the patient to come. They put incision. At the time, there is no bleeding. But it is a double surgical procedure. At the time, they do alveoloplasty. First day, only extraction and suturing. That's
But we can do like that. They doubt to this.
Yes.
Like they tell like either we have to extract and put implant immediately, illana we have to wait for 1 or 2 months. Not
No,
like
not
that.
like that. After
There will be
2
infection in the socket.
not
nothing
infection.
like that.
The
1 or 2
granulation tissue
days.
will be forming that you can curate it out. Anyhow, we are going to do a
So we can do like that.
There won't be any socket. He does only like that. In any case, he first extracts all the teeth, wait for 2 to 3 weeks, soft tissue healing will be done. Then they will put incision, flap reflection, alveoplasty. At the time, what he says is, I don't want to mess with bleeding, I don't want to work with a lot of bleeding, I want to work relax. That is also me. Otherwise, you can remove selective teeth and you can wait also. Because it is too much stress to handle, no? Implant placement also, alveoplasty also, bleeding control is the main trouble. So tentatively right side 7 looks good, right? Even placing implant in distal root may not be ideal because in the mesial side there is bone loss. But the good thing is the mental foramen is near mesial root of 6. Have you observed in the 3D view? Usually, yesterday and today's cases it was below the second premolar, now it is in the so in one way it is good. You can place all your implants in front and you can give one cantilever. Or you can tell the patient we won't give more.